안녕하세요. Hello everyone. I'm Dr. Jae Gon Kim. Nice to meet you all. First of all, silicone and goretex implants are really popular. So they are the basic two that we choose from. And the main difference comes from the surface characteristics of the two. So silicone implants, they have a really smooth surface and with no pores. And goretex implants, they have really small pores. I think about 0.2 microns. So tissue can grow into those pores. No tissue can grow in the silicone implants, so they form a capsule, but no capsule is formed for goretex implants. Since silicones have a capsule around them, when we need to remove it, it's relatively easy to remove the implants. But for goretex, it is kind of difficult to do that, but it's not impossible. And for the carving, every implant needs to be carved a little bit after it is applied because every patient has a different kind of contour, and for different contours, we need to carve it to fit. So silicone is relatively easy to carve, and goretex is kind of difficult to do that. Silicone implants don't change the shape as time goes by. So after it is implanted, shape doesn't really change much, but it is said that goretex can shrink a little bit after it is implanted as the tissue ingrows. So it could change a little bit. So we have to kind of keep in mind that it could change a little bit. And the goretex implants kind of changes the shape according to the floor. Silicone doesn't change the shape, so minor flaws in the floor can be camouflaged. But if you use goretex, the floor needs to be near perfect. In some cases, that if you have really thin skin, if you use silicone implants, it has a risk of showing, but goretex has a relative low risk of showing. So they have different characteristics. But these merits and demerits can be covered in some way. If you have really thin skin and if you want to use silicone implants, you could have some tissue padded over it. Those can be overcome. The characteristics are really important, but the more important thing is maybe the surgeon's preference or his or her experience about it, and those are, I think, more important. In our clinic, we use mostly silicone implants, and it could be divided into some different categories. Some kind of implants are classified as soft type and some are high soft type. So some needs to be used for more thin skin, and more harder implants can be used for that. Some implants are made by extrusion, so they have really very smooth surface, and others are made by carve type and they have relatively a rough surface. They adhere more to soft tissue. So if you need slighter more fixation, you use that. And some implants are 3D printed to fit really well. If the patient's contour is kind of extreme or extremely deviated in some way, you could use a 3D type prefabricated implant. As a plastic surgeon, we could check if there is narrowing in the airway and we could relieve that. But those are like forms. So we could correct the forms and make the airway more symmetric, or we could maybe improve the narrowed parts. Those don't really correlate with the symptoms. Some people, they have a really huge deviation with very small airway and they don't have any symptoms. And some people have really slight deviations and they might suffer from difficulties of breathing. So we could straighten the deviated parts and make the airways more wider. Most of the cases, they could improve in some breathing difficulties, but not all can be solved. Okay, if you see your nose from the underside, it could be like a triangle. So there are 3 sides of a triangle, and if the base is wide, we remove some tissues from the base, and like muscles cannot be really removed, so we narrow the muscles. So if you have a really wide alar base, you could have a alar base reduction. But some people, they have relatively narrow base, but the other 2 sides are like convex, so they're kind of protruded. In those cases, we reduce the length alignment of the sides and change the shapes so they could look more beautiful. Alar reduction can be done on their own, and it could be combined with rhinoplasty as well. It's all about the preference and what you need. If you need a rhinoplasty and you need alar reduction, we could do it at the same time. But if you only need alar reduction can be done only. Yeah, that's all, and thank you for watching. And if you have concerns or interest in plastic surgery, don't overthink it and come to our clinic, have consultations, and we could talk it over. Thank you.